In this talk, I want to address the topic of maintaining our mental health during these very challenging times of the COVID pandemic. In my own clinical practice as a psychiatrist, in my own department with my fellow clinicians, and certainly with early research, we are noticing rising rates since this pandemic started, not just of infections with coronavirus, but also, very concerningly, rising rates of depression and anxiety, of substance abuse problems, and even suicide. A recent survey, for example, reported that nearly half of Americans believe that the coronavirus pandemic and the associated lockdowns have adversely impacted their mental health. So the first thing that I want to say in this regard is that if you are struggling with these or with other related mental health problems, you are not alone. Human beings are not built for what we're going through right now. This is simply not normal. So if you're wondering, why am I so stressed? Why am I so anxious? Why am I so gloomy or having a hard time getting out of bed? The first thing to realize is that this is an entirely understandable reaction to what we're going through. At the same time, it's something that causes a great deal of anguish and suffering. Depression and anxiety and related problems are nothing to sniff at. And so in this talk, I want to not just sort of describe the nature of the problem and why this might be happening during the lockdowns, but more importantly, I want to offer 7 or 8 practical and concrete suggestions that you and your families and your friends can implement in order to try to reduce your risk of these problems or to help you recover from these problems if you're suffering in this way. And I want to begin by sort of describing a common pattern that I'm seeing in my own patients since the stay-at-home orders began. And the pattern involves a kind of disruption, obviously, to our normal routines. So a person may stay up late until 2 in the morning because they don't necessarily have to get up early for work the next day, binge watching Tiger King on Netflix, snacking on potato chips, and then the next morning sleeping in till 10 or 11 in the morning because there's no urgency to get up and go to work. They might stay in their pajamas all day or maybe throw on a shirt if they have to go to a Zoom meeting. But there are obviously fewer face-to-face encounters with other people, oftentimes a lot less meaningful work. There's a few things that I can do from home, but a lot of things have been put on the back burner until I can get back to the office, or maybe one has lost one's job. And so there's even less structure and less that's sort of pressing on me and demanding work or discipline. And this produces this kind of a recipe for an unhealthy sleep-wake cycle, very little physical activity if it's hard to get to the gym or to do our normal physical activities, too much screen time, maybe the use of excess alcohol or the use of drugs to cope with boredom or to manage stress or to reduce anxiety that we might be experiencing over the possibility of losing my job or the fact of being unemployed, or even anxiety about acquiring the virus itself. I came down with coronavirus about a month ago, and thanks be to God, in my case, it wasn't too severe. I didn't need to be hospitalized. And it's been kind of liberating since then, not to worry as much about acquiring the infection. But as someone who works at a hospital, I think I didn't realize just how that fear of acquiring the virus or passing it along to my family members was always there in the back of my mind, and no doubt affecting my overall level of stress. So the coronavirus pandemic has produced many disruptions in our society, obviously, but I want to maybe summarize the kinds of typical disruptions that it has created in our own biological and psychological rhythms, whether or not you suffer from a diagnosable mental health condition. We've seen disruptions to what psychiatrists and physicians call our circadian rhythm, the natural sleep-wake cycle that our brain engages in every day. Disruptions to our social connections. We know that loneliness and social isolation had reached epidemic proportions even prior to the coronavirus pandemic. So this is exacerbating a social problem that was there even before the pandemic started this year. Disruptions, obviously, to our work routines, disruptions to our everyday sense of meaning and purpose. We're sort of waiting and biding our time, waiting for this to be over, rather than seeing each day as a gift and trying to use this time well. And I want to suggest to you that we can choose to see the current pandemic only and exclusively as a crisis, and no doubt it is a kind of crisis. I don't want to minimize or trivialize that fact. But we can see it only as a crisis, or we could see it as, yes, a crisis, but also an opportunity for psychological and spiritual growth. So here are my 8 recommendations for maintaining and preserving and recovering our mental health during this pandemic. And the overarching theme of these recommendations involves, you could say, reintroducing some of the structure that was lost or that has been lost by these disruptions. So let's start with sleep, because I'm seeing lots and lots of patients coming to our clinic who have never had problems with sleep in the past, now suffering from insomnia or other sleep-related difficulties. Some basic sort of sleep hygiene 101 that all of us can practice. Even if you don't have to get up and go to work, try to get up at a fixed time every day, and try to avoid napping during the day. Another thing that you can do to entrain the circadian rhythm into your brain is, within an hour of getting up in the morning, try to get outside and let that ultraviolet light from the sun hit your retina, hit your eye. There's a direct connection between sunlight hitting your retina and the hypothalamus in your brain, the central control and coordination center of your brain that controls your circadian rhythm. Regular meal times can also, very interestingly, help re-entrain your brain and your body to know when it should be awake and when it should sleep. So our metabolism actually changes as we get disruptions to our circadian rhythm. We know that people who have the exact same diet, the exact same caloric intake, but who work night shifts will tend to gain weight, even though they're eating exactly the same thing as they were eating when they had their day shifts. I would add a social dimension to food and meal times as well, and that's, some of us live alone, and this is obviously going to be harder in that context, but if we live with other people, really trying to prioritize family meal times. Again, we could see this as a crisis, or we could see it as an opportunity, right? Johnny doesn't have soccer practice today, and Susie doesn't have to go to violin or ballet, so we can actually sit down and eat dinner together as a family more frequently during the stay-at-home period than we did prior to the coronavirus lockdowns. A friend of mine who's a public speaker and expert on parenting, he's written several books, likes to say that the most important school that your children will ever attend is the family dinner table, which is a really beautiful thought, right? So let's make meal times not just a chance to sort of refuel and, ingest the biological material that we need to keep our body going, but let's approach it in a very human way, as an opportunity to sit with those that we live with, to sit with those that we love, and share nourishment together, share conversation together, find out how everyone is doing, reconnect in ways that perhaps were more challenging when our lives were busy because we were going every which direction in the evening. So, sleep, regular meal times. Third recommendation is, even if we happen to be out of work, or even if our usual professional work has been put temporarily on hold during stay-at-home orders, to nonetheless set aside time every day for work. Could be professional projects that have been on the back burner. Could be home improvement projects. It could be projects of personal development. Right? Take an online course. Start going through the reading list, those books that you've always wanted to get to but never had time. Take up a hobby, a musical instrument. Use this as an opportunity to do things that in the ordinary course of events you don't have time for. Recommendation number 4 is to set aside fixed time every day for prayer. We can live stream the Mass, obviously not the same as going to Mass every day, but if our work schedule made it difficult to attend daily Mass during the week, well, here's an opportunity to get into the liturgical rhythm of daily Mass, to participate in the feast days that we see sprinkled throughout the calendar, throughout the liturgical year. It's good to set aside time for other forms of prayer as well, besides trying to follow the Church's liturgy. Mental prayer, sometimes called contemplative prayer, just sitting in silence, in quiet contemplation, in quiet conversation, heart to heart, with our Lord, with the Holy Spirit, with God the Father. Vocal prayers like the Rosary, spiritual reading, chapter a day from the New Testament, 10 minutes a day from another good spiritual book, maybe something that one of the Napa Institute speakers has written, or one of the classics of Catholic spirituality, again, that you've always wanted to get to but maybe never had time for or thought you didn't have time for. Here's a wonderful opportunity. The coronavirus produces a lot of anxiety. The air is almost thick with it. And one of the remedies, without sort of trivializing clinical levels of anxiety, without suggesting that all anxiety can be solved by prayer, we do have solid scientific research showing that prayer and meditation, quiet contemplative prayer, meditative reading, can diminish anxiety. And of course, for Catholics, there's the additional component of prayer allowing us to place these worries into the hands of God, our loving Father, to remind ourselves of our divine filiation, this deepest truth about ourselves and about our existence, that God is my loving Father, that I am a son of God, I am a daughter of God, I'm a child of God, so that I can abandon these concerns into the loving hands of God's providence. Physical activity is very important. I'm not going to use the word exercise because that can intimidate some people. But if you're getting outside for a few minutes within an hour of waking up, which is my recommendation to cue your body that it's morning, it's time to be alert, it's time to be awake, use that as a chance to do a brisk walk around the neighborhood. Wear a mask if you need to, if the neighbors would prefer that. But get outside, get moving. Inside, start engaging in some form of physical activity, whether that's an exercise video, stationary bike, anything that you can find and anything that's available is going to be helpful, not just for your physical health, but also for your mental health. So, for example, for mild to moderate depression, repeated studies have shown that 30 minutes of aerobic exercise 4 times a week is as effective as an antidepressant medication. More severe forms of depression becomes very hard to exercise and engage in physical activity, but if you have mild symptoms of depression and you want your antidepressant medication to work better, or maybe you want to avoid going on an antidepressant medication. Start with 30 minutes a day, 4 or 5 days a week of a regimen of physical activity or aerobic exercise, and you will see benefits from that. Not right away, not the next day, but cumulative effects over time as you do this for a few weeks. And I know that when you're feeling depressed, that's precisely when you feel like exercising the least. But if you can get yourself to do it, if you can motivate yourself, maybe exercise with someone else who's living in your household to motivate one another, precisely when you feel like doing it the least, it can be the most beneficial. One of the effects of depression is that it tends to make us withdraw. We feel like we have very little energy, very little gas left in the tank, and the impulse or the inclination is to want to conserve that energy. I'm just going to stay in bed, I'm not going to get up, I'm not going to exert myself. But there's a kind of paradox here that with depression, in order to replenish your energy, you have to expend the little energy that you have. You have to push yourself beyond what you're comfortable with in terms of physical activity, in terms of connecting with other people socially. And if you do this steadily over time, your gas tank is going to start filling up. That physical energy, that emotional energy, that motivation will begin to improve. I know it's difficult, but anything you can do to help motivate yourself or to get external props and supports from other people to help motivate you will be very beneficial. So, physical activity. Recommendation number 6, find creative ways to maintain social connections. Right? So I've been sort of down on screen time, but of course, too much screen time can be a problem, but especially if you're isolated and you live alone, obviously a Zoom meeting or a video chat or a FaceTime with your family, with your friends, is better than social isolation. So learn how to use these technologies in positive ways to maintain daily connections with other people, to maintain, a weekly connection with my family or with my extended family. That, Sunday afternoon Zoom call with family that's living at a distance. This might be a good time for that. If everyone is at home, and 6 months ago it may have been hard to coordinate something like this, well, now everyone is much more available. This is an opportunity to do that. As an act of charity, if you have neighbors, if you have older family members who are not proficient in the use of these technologies, reach out to them. Walk them through the process of downloading that video chat app and showing them how to use it and making sure they get dialed in to group chats or to virtual get-togethers. This is one of the things that we can do to help address this profound problem of loneliness and social isolation, especially among the elderly, especially among people who live alone, especially among those who may be living in a nursing home with very strict visitation requirements during this time. Be somewhat careful with social media. Social media can be a way to connect with other people, but it can also be a way to make unfavorable comparisons between myself and other people. People tend to present their best selves on social media. They don't tend to come on social media and describe that they're feeling stressed or anxious or depressed or they're starting to drink more or whatever. So limit your time if you're finding that Facebook or Twitter or Instagram is making you feel more isolated or more lonely or more like a failure or whatever. Okay, maybe it's time to set that aside and pick up the phone and call someone or FaceTime someone face to face and have a real human encounter so that you can have someone that you can describe your difficulties to, so that you can hear that they too are struggling in this time. Maybe not with the exact same thing that you're struggling with, but they have their own weaknesses, their own vulnerabilities, their own challenges and difficulties. Recommendation number 7 involves service to others. Getting outside of ourselves and giving ourselves generously to other people in very small, simple ways every day will help you regain a sense of meaning and purpose, will give you some direction, will help you to realize that I may be struggling with working from home, which is a little bit of a nuisance, but I can see that there are people that have been laid off from my company that have it actually much worse. At least I still have a paycheck. I need to reach out to those folks and see what they need, or even just offer them a word of encouragement. Right? Handwritten letters are an extraordinary gift. They are a real pick-me-up. They're something that can certainly brighten anyone's spirit, precisely because they're so rare these days, when it's much easier to just fire off an email or a text message or a direct message over social media. So maybe one of the little things I'm going to do is sit down every day and just write a brief handwritten note to a family member or to a friend or to an old friend that maybe I've lost touch with, and now is a good opportunity to reconnect with them. Eighth and final recommendation is to do an examination of conscience in terms of how we are living the virtue of temperance, right? That human virtue that helps us to regulate our various appetites. We know that alcohol consumption has gone up during the pandemic, and alcohol consumption in and of itself is not a bad thing. We can recall the In Vino Veritas get-togethers at the Napa conference when we're able to get together in person. What a wonderful way for us to connect with other people over good wine enjoyed responsibly. But if we find ourselves drinking alone, if we find ourselves drinking in order to self-medicate our anxiety or our depression, we may need to pull back, right? Maybe I'm going to limit my drinking just to virtual happy hours or virtual get-togethers where, 6 p.m. on a Friday evening, we get on Zoom with some friends and chat over a beer or have a conversation over a glass of wine. Certainly if we're using drugs, including prescription drugs that were not prescribed to us in order to self-medicate or manage anxiety or depression, it's time to seek a consultation ideally with a psychiatrist, or if one is not available, with a primary care physician, to see, if there's a better way for me to deal with or treat my depression or my anxiety or my high level of stress. The final point I want to make is that if you are struggling with depression or anxiety in ways that are really starting to impair your daily functioning, right? I'm trying to put into effect these recommendations that I heard in this talk, and I literally can't do it. I feel too overwhelmed, or I feel so sapped of energy that I literally cannot get up and brush my teeth in the morning. It's time to seek clinical attention. It's time to seek evaluation from a psychiatrist. And if you're wondering about the possibility of going into a clinic, most physicians, most psychiatrists and psychologists have converted to video visits. So you can do a consultation, from your own home with a physician or a mental health professional and see, is there something going on here that may require psychotherapy or medication treatment or some other medical intervention in order to address. This is nothing to be ashamed of. There is, unfortunately, an unjust and unfair social stigma that still attaches to mental health conditions or mental illness. But just as it would be foolish for someone suffering from diabetes to refuse insulin or to refuse medical interventions for that condition, so likewise, if you're suffering from a level of clinical depression or severe anxiety that's impairing your functioning, it would be foolish to not avail yourself of potential medicinal remedies, of the help that professionals can offer. And it's not an either-or proposition, right? Should I try to exercise and and eat more healthy and get my sleep in order? Or should I take a medication for my severe depression? Well, you can do both. And in fact, the medication may make it possible, more possible for you to do those activities. And those activities will in turn make the medication work better. We know from research that a medication alone for depression can be effective, and psychotherapy alone for depression can be effective. And at least for mild depression, exercise alone can be effective. But if you put these things together, you get better outcomes, a faster recovery, more full remission of symptoms than if you just do one or the other of these things alone. So think of this as a both and rather than an either or kind of proposition. In closing, I'll mention just a few examples of people who lived through these kinds of difficulties or even sort of more severe circumstances than this. The first is a 20th century psychiatrist, a man by the name of Viktor Frankl, who is a Jewish man who was imprisoned in a Nazi concentration camp. He was imprisoned in Auschwitz. And he noticed there that those people who managed to survive in those horrifying human circumstances did so only because they were able, in those circumstances, to find a sense of meaning and purpose, to find a sense of hope. And of course, as Catholics, we know that hope is a theological virtue. It's not something that can be delivered in the form of a pill. So getting up in the morning, praying, connecting with God, asking Him, what is it that you want of me today? It may not be something huge and heroic. It probably won't be. It may be a series of small acts of charity, a series of small things that I'm working on to make my life better, to make my family's life better, to make my home more of a home. Everyone needs something like that in order to get through difficult circumstances. We can mention as one kind of contemporary 20th century saint the example of Saint Josemaria Escrivá, a saint that I'm very fond of. I've learned a lot about the spirituality of work and the spirituality of being a layperson from him. But during the Spanish Civil War, he was in Spain, he was a Spanish priest. During the Spanish Civil War, when they were literally assassinating and murdering priests, thousands of them died. He had to hide because he was a priest. And for a time, he found refuge in the Honduran consulate. He had a friend who had a connection there. And so there were dozens of people crammed into very small spaces. So he and a few other young men were staying in a tiny room together where they barely had enough room to sort of lay their sleeping bags out on the floor and their blankets out on the floor. But he decided right away that we're not going to be idle here. We're not just going to see this as something to kind of bide our time and get through. We are going to use this productively, right? Even though externally the environment isn't very conducive to prayer and to work and to personal development. Nonetheless, we're making a schedule. We're going to have prayer at a certain time every day. We're going to have Mass, and he would say Mass when he could acquire bread and wine, and when he couldn't, he would do a kind of dry Mass, going through the liturgy, but without the consecration, without Holy Communion. Then he and his friends would do things like study foreign languages and work for set periods of time every day in order to acquire new knowledge or new skills that would be useful to their apostolate in the future. Right? And what they noticed during this time is that as difficult as it was, they were able to maintain their good spirits. Certainly this was a struggle, but those around them who just sort of languished, who were twiddling their thumbs and staring at the walls and waiting for all this to be over, tended to sink into a kind of lethargy and a kind of depression. So he can be a good saint for us to look to for inspiration, or a good intercessor for us during these challenging times. If you want to read more about his work, and especially the time during his confinement in the Honduran consulate, John Coverdale's biography called Uncommon Faith is a very good read. So in closing, I want to remind all of you that everyone is going through a difficult time right now. You are not alone. If you're struggling, this is not unusual. There is hope for recovery. Follow the advice that I've given. If that isn't sufficient to help you and you're still struggling with daily activities, reach out to your doctor, get a referral to a psychiatrist or a psychologist, arrange a consultation, and don't be afraid to ask for help from those around you, from your family, from your friends. Don't be afraid to talk about your struggles during this time, because most likely those people you reach out to for help will also be struggling in their own way. And to connect with them and share the difficulties that we're going through is in and of itself the first step toward recovery. I wish you all the best. I'm praying for all of you during this challenging time. I look forward, hopefully, to seeing you in person at next year's Napa conference, if we're able to gather. God bless you.